1. At puberty, the three parts of the hip bone are separated by triradiate cartilage centered in the acetabulum. But when do the two parts of the ischiopubic rami fuse? A. Ninth year. B. Third year. C. 15-16 each year. D. 24th year. The answer is A. Ninth year. 2. Which part of the ischial tuberosity touches the table or chair while sitting? A. Upper lateral part of the upper quadrangular area. B. Lower medial part of the upper quadrangular area. C. Medial part of the lower triangular area. D. Lateral part of the lower triangular area. The answer is C. Medial part of the lower triangular area. 3. Which of the following structures does not cross the dorsal aspect of the ischial spine? A. Pudendal nerve. B. Internal pudendal artery. C. Internal pudendal vein. D. Nerve to quadratus femoris. The answer is D. Nerve to quadratus femoris. 4. Which part of the patella articulates with the femur during full flexion? A. Medial part of lateral articular part. B. Lateral articular part. C. Lateral part of medial articular part. D. Medial part of medial articular part. The answer is D. Medial part of medial articular part. 5. All the secondary centers of ossification in the lower limb appears after birth except A. Lower end of tibia. B. Lower end of fibula. C. Lower end of femur. D. Upper end of femur. The answer is C. Lower end of femur. 6. What is the third structure attached to the intercondylar eminence of the tibia when moving from anterior to posterior? A. Anterior horn of lateral meniscus. B. Anterior horn of medial meniscus. C. Anterior cruciate ligament. D. Posterior horn of medial meniscus. The answer is A. Anterior horn of lateral meniscus. 7. Which is the only muscle that is inserted into the fibula directly? A. Quadriceps femoris. B. Biceps femoris. C. Plantaris. D. Semitendinosus. The answer is B. Biceps femoris. 8. What is an increase in the neck shaft angle of the femur called? A. Coxa valga. B. Coxa vara. C. Coxa cava. D. Talipes equine varus. The answer is A. Coxa valga. 9. Where is the location of femoral branch of genitofemoral nerve? A. Femoral canal. B. Lateral compartment of femoral sheath. C. Middle compartment of femoral sheath. D. Medial compartment of femoral sheath. The answer is B. Lateral compartment of femoral sheath. 10. A femoral hernia descends through the femoral canal and the neck of the hernia sac lies A. Superior and medial to the pubic tubercle. B. Inferior and lateral to the pubic tubercle. C. Inferior and medial to the pubic tubercle. D. In the obturator canal. The answer is B. Inferior and lateral to the pubic tubercle. 11. All of the following muscles are flexors of thigh except A. Sartorius. B. Vastus medialis. C. Rectus femoris. D. Iliopsoas. The answer is B. Vastus medialis. 12. Name the artery that is likely to be injured in fracture of shaft of femur. A. Femoral artery. B. Profunda femoris artery. C. Superior gluteal artery. D. Peroneal artery. The answer is B. Profunda femoris artery. 13. Which of the following structures does not form the boundaries of the femoral ring? A. Inguinal ligament. B. Sharp edge of the lacunar ligament. C. Pecten pubis of superior ramus of pubic bone. D. Cloquet's lymph node. The answer is D. Cloquet's lymph node. 14. All of the following features related to the adductor brevis are correct except A. Forms part of floor of femoral triangle. B. Supplied usually by the posterior division of the obturator nerve. C. Adducts the thigh at the hip joint. D. It is the muscle of medial compartment of thigh. The answer is B. Supplied usually by the posterior division of the obturator nerve. 15. Which muscle tendon is associated with Reiter's bone? A. Adductor magnus. B. Adductor longus. C. Gastrocnemius. D. Biceps femoris. The answer is B. Adductor longus.